is the third and final part of this three-part series. And I know you got to hear Trish Caldwell if you've been in the first and the second one. This is a standalone webinar, even if you haven't been to the first or second. Although if you have, integrating all of those parts and pieces with this one will make it all that much richer for you. So first of all, a little bit about me, as we wait for people to finish joining. My name is Wendy Elliott, and I am Corporate Director of Family Services for Promises Behavioral Health. And a little bit about my background, just because I do think it lends a little bit of a color to why it is I do what I do. I grew up in the Midwest, and my first degree was as an undergrad in education, and I was a science teacher, geography teacher for middle school. And so the transition into behavioral health kind of felt natural to me. And then for about 15 years, I was also a small agricultural, like a community supported agricultural farmer. And that is where I fell in love with systems. That is where I started to really play around with the interconnectedness of other living things, other organisms, other people, other plants, other animals. And then I moved to Philadelphia. That is where I am calling in from today, Philadelphia, Pennsylvania, where myself and my family live, and finished a master's degree at Drexel in marriage and family therapy, and have been working in behavioral health ever since. So Trish Caldwell has been my mentor through my entire career. So a lot of the words that come out of my mouth, if you've heard her speak, will sound very similar. She has been a crucial and integral part of my own like career development over time. So I have worked with clients, everything from detox, dual diagnosis, residential outpatient, all the way into a private practice, long-term care. And about probably 90–95% of my clinical hours are all relational. So the more the merrier. I truly do love to work within family systems. And I really believe that everyone deserves recovery, everyone and their entire systems. It's a little bit about me and where I'm kind of coming from. I do love this work, and I really love the intricacies and just the complexities of a family system. So I wanted you to know that a little bit about me there. And then a little bit about promises. If you've seen this slide before, this is a map of the United States, and it kind of shows in a snapshot the 7 inpatient facilities and the 2 standalone outpatient facilities that we have in the Promises system. And there's some pictures of what some of our sites look like to kind of give you a sense of place and a sense of space. I always know that knowing where we're going, what it looks like, how to do it is a very trauma-informed approach to getting people in our care. So if you know somebody that is needing access to care, please know that Promises is payer agnostic and also diagnosis agnostic, which means that we serve a patient population that has both private insurance, but also Medicaid. And it also means that we service those that have a primary mental health diagnosis and also a primary substance use diagnosis. With that, Callie, I think I can turn this over to you.
Good morning. I know a lot of you have seen this slide too. You know who I am. Just to kind of go over a few things. So before I get to the CE process, for the chat and Q&A today, like normal. So Q&A, if you have questions for Wendy, put those in there so I can make sure she sees those. We're going to take a 5-minute break kind of in the middle, and that's when Wendy will look at your questions and kind of we'll go through those together. The chat is really just for if you need to talk to me. So if your audio is not working, if you have any questions about the CE, anything like that, send it into the chat. That way we're not kind of getting those muddled with like important questions we want to get over to Wendy. For the CE process, it's the same as it was last month. So if you were here last month, it's going to be similar. Basically, today after this training, I'll send you all an eval. That eval will come from our tool called JotForm. So ensure that, like, especially I've noticed that if you have a professional email, like a clinician email, those typically have higher spam barriers. So the JotForm email with your eval could likely end up in your spam. So look for that today. It'll come out like within a few hours of the training. So if you don't see it by the end of the day today, check your spam. And if you don't see it there, let me know. It also matters for how long you're in the training. So you can only miss up to like 5 or 6 minutes of the training to get your CE credit. That's an accreditation role, not my role. So if you don't get that email, I will send an email to everyone that would join but isn't going to get CE credits. So you'll kind of know if maybe like you just didn't get all the, like you weren't here the full time. Know that I really do look at every single like login through Zoom to make sure that even if you logged in and then had to leave for a moment and came back in, if you still met that criteria, I add in your time together. So it's listed as like the full amount of time. I really do go through that very tediously. And also with email. So if you registered through Zoom with like a personal email, that's where your evaluation, everything's going to go to. So make sure that even though you may have registered with your work email, but then you joined Zoom on your personal email, everything goes through whatever like you attended Zoom on today. And if you're here, that means that you've registered. That means that you're here. It was a closed, like you had to register to be here. So I'm not worried that if you're here, you're not going to get that credit. So don't ask me to check because I have to go through like 500 of you to check and I'm not going to do that. So if you're here, you're registered, you're going to get the credit. So don't worry about that. After JotForm will send you that survey, it automatically replies with your certificate. So make sure again that you're looking for that email from JotForm, and the subject line is something like download your certificate or your certificate is here. It's very clear. And I think you'll get like a copy of your eval as well. So you'll get that immediately. You don't have to wait on me to like send you that certificate again. And I think that's it. It's 2 credit hours. Oh, the slides and other resources, and everyone wants the slides. We do send out a recap email with the recording and like your slide highlights. So you won't get every single slide, but you're going to get enough that's going to be the full picture of like what Wendy is discussing today. I'll list any resources that she talks about, books, that kind of thing. And that email will likely go on Monday or Tuesday next week. So that'll be separate. That's like from our PBHU email system. So that will come out on Monday. Today you will get your eval. So make sure you fill that out. And you have to fill it out before like Wednesday or Thursday, again, to get your credit. So make sure when you see that eval come through, it'll be from JotForm, and fill that out as soon as you can. I think that's it.
Thank you, Callie. I just as a
Sorry, I'll cover
okay.
it.
I don't mind speaking to this.
Okay, great.
So as I mentioned when I first got on, that was the first series, 3-part series was on trauma-informed care. And the second series, the new series, will be the importance of integrated care in the treatment of substance use and mental health. And so the next 2 in April and May are listed here. You'll get to hear Trish again next month for trauma-informed care for suicidality and motivational approaches. And then in May, the integrative care and behavioral health from our executive director down in Houston, Sarah Goldman. So feel free to join us again. Check out, you'll get those emails so that you can register, and then you can continue on your CE credit space. Also, just know, and this will be in the email that will come to you also, that if you love to listen to my voice and you want to know more about what it is that I do in the family context, I do a weekly webinars for families. It's on Mondays and Tuesdays, and you can have access to those. They are geared towards families, but you are welcome to sit in on them if you wanted to see what it is I talk about, how I talk to families about. It's all psychoeducation, everything from brain to codependency to protective factors to relational skills. And there's also a welcome treatment webinar that my colleague does on Mondays. So you are welcome to show up to those. And they are a silent webinar also, so you can just listen in and see how it is we speak to families in their care in really early recovery. That will also be available to you. The link to that will be available to you also. So just want to let you know that. Okay. So these objectives, I'm actually going to go off camera so that I'm not in my way. Okay. So our objectives today were also part of I believe that one of the original emails that you had gotten was to define trauma, apply trauma-informed approaches, and then build a family programming to support the system recovery and the continuum of care. Generally speaking, this is in two parts. The first part is primarily theoretical, and then the second part is primarily practical. I've tried to balance these two parts, so it's half and half. And in between there, we'll take like a 5-minute break. And as Callie was able to, she let you know that that's when I'll take a look at the questions. I'm not super awesome at like reading questions and going through a presentation at the same time. So I'll take a look at your questions during that 5-minute break and then either address the answers directly or integrate them into the second part of the webinar. And then if you have any additional questions, of course, you can always reach out to me after our training today. As I mentioned before, this is a standalone webinar. However, I am assuming that most of you have been to the other parts of this trauma series. So keep in mind how those trauma-informed principles sit within the family dynamic perspective that we're going to be talking about today. It'll just make your experience all the richer. Okay, so let's get started. Family trauma. First, we're going to start with some definitions. Okay, so definitions that I just wanted to highlight is from the DSM itself. Trauma is defined by the exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways: directly experiencing the traumatic events, witnessing in person the events as it occurred to others, and learning that the traumatic events occurred to a close family member or friend. So right there inside is the family space. Who is family? I like to think of family, of course, as like who's got your back. It could be your partners, spouses, siblings, children, parents, other relatives, something like that. Inevitably, when I do this talk, someone will ask, well, what about the clients that truly don't have family? And as much as I appreciate the concern for these clients, and that could be a whole other webinar on building those relational recovery skills and connections from like nothing. And one I could probably do, but I don't want to distract from the conversation we're having here today about with what we could see as like exceptions. Because it makes me wonder, like, what are we trying to avoid? We're probably trying to avoid working with the families that we do know that we need to work with. So we are speaking really specifically here with family connections, whether it's chosen family, blood family, however the family might look for our clients. Systems. System is a group of interacting or interrelated elements that act according to a set of rules to form a unified whole. So a system surrounded and influenced by its environment is described by its boundaries, structure, and purpose, and is expressed in its functioning. Rules, right? We talk about rules, and yes, families have rules. And that's part of when we're looking at the way families interact with one another, is like, what are the rules within this family system? Because those rules keep that family moving, that system moving forward in a way that functions for them. And when they're trying to improve functioning, that's when we start to look about what's happening with the structure, what's happening with the boundaries, what's the purpose of this systems moving forward, particularly in the recovery space. All right, back to trauma. So, make sure. Here's a short list of some highlighted traumatic events that our families could be exposed to. Witnessing an overdose, witnessing a suicide attempt or a loved one engaging in self-harm, domestic violence, behaviors that are associated with substance use seeking, whether it's people will talk about manipulation, the stealing of money, the trying to get people to do things for them that they need in order for them to continue using. Recognizing that law enforcement, police in the home, first responders showing up, there's nothing more traumatic than a fire engine coming down your street with all their lights and sounds blaring. And then just the daily life and death threats. Do I know if my loved one is breathing when they're in their room for too long, right? Am I sure that when they go out to hang out with their friends that they're going to come back? And the system around our loved ones that are struggling also might be traumatic, whether there's gang violence can be a big thing, or if there's dealing going on, those relationships can be really scary. All of these events impact the family as a whole. So I like to think, when you think of families in the circuitry of their own nervous system, and repeated stress actually impacts that nervous system, and everyone in the system is impacted. So how does trauma impact family resilience? At the root, connection is disrupted. I will be coming back over and over and over again to this idea of connection, this idea of how do we stay connected, which is where the co-regulation piece in the title fits in, is recognizing that our need to be connected is part of our human need. And at the root, when there is trauma, that connection is disrupted, because both trauma and substance use disorder live in isolation. So over time, recognizing that during traumatic events or because of traumatic events, the family's worldview actually shifts, right? So when you think of a traumatic event and then how the family will then adjust. So you think of like their personal vulnerability. And you'll hear families say, when you call them, hey, I'm okay, it's my loved one that has the problem, right? They've separated themselves and their own vulnerability from the trauma in order to kind of compartmentalize and recognize that they can't themselves be vulnerable because of the trauma inside their family system. And so they might put it on someone else, right? It's my loved one that has the problem. I'm okay. I get that a lot when we talk to families, particularly right after an acute traumatic event. Safety alters. And in the residential level of care, there's a lot of checking in all the time to be sure they're okay. We'll get emails. Hey, I just want to make sure my loved one's okay. I want to make sure my loved one's okay, right? Because their ability to feel safe and recognize safety has been compromised and altered during traumatic events. And also the idea of control. We'll get, they're such, they're helicopter parents, or there's that wife is so codependent on their husband. We get a lot of these very like almost like judgy sort of language because of the control. And why? Because control can look like warning a therapist about a loved one's manipulation techniques. I always think that's interesting. They're like, just so you know, they're very, very manipulative, right? They're warning us as a way of controlling their situation because they feel like it's out of control. Maybe it could be with ultimatums. Financial control is a big one. Research shows that following a traumatic event, families commonly experience a shift in attitudes and beliefs that represent a need to focus on safety issues as they relate to their self and others. According to this research, safety issues are expressed in the family's worldview in the form of suspicious, distrustful attributions concerning the motivations of others, but it can also be seen in various symptoms of family members, their fearfulness, their phobias, their anxiety reaction. So our families are experiencing the same symptoms that the identified patient also is experiencing. So the question is, can a family have PTSD? And we just talked a little bit about what trauma might look like inside of our families. I like to think of, generational patterns that highlights PTSD in a family. So like a wife reliving the experience she had, with her husband, who's now in treatment based off of her experience as a father who maybe was using or had some mental health issues, right? So her own PTSD from her past is now being, brought up again when her current system is also in struggling. Or like a parent reliving their own personal trauma when their child is suffering. And sometimes that's when we start to see some behaviors that we seem confusing, they seem destructive, or they don't seem to fit with the trauma that the identified patient has. Is because of the actual trauma that the family members themselves are experiencing. I'd like to talk a little bit about primary versus secondary trauma experiences. And I was talking to a colleague recently who's doing some research on secondary trauma in therapists. And we as therapists recognize that that's a real thing, right? When we work with trauma clients over and over and over again, we can suffer from secondary trauma, and we're only meeting with them for an hour once a week. Imagine the exponential effect of families that are inside of that system and other members of families that are experiencing that secondary trauma. We know how it affects us. So it doesn't take not much of a jump to determine like this is going to have an exponential effect on the family members inside that family system. Certain behaviors show up. So why do we look at PTSD so differently between the patient and the family? We recognize when a patient is hypervigilant, but when a family member is being hypervigilant and checking in all the time, we tend to disdain that. Give it like, we got this, right? We don't like it. We're like, you're not the identified patient, so you shouldn't be feeling that way, right? Because for a family, control is a way to deal with their own increased anxiety. And that shows up over and over and over again. And so when we know that from a trauma-informed lens, we can start to see those families with that lens of compassion of like their experience is also an experience. It's not just the experience of the client that I have here with me. Toxic stress and stress responses in families. So toxic stress. We all experience some from time to time, right? So toxic stress is the most threatening. It is associated with strong and prolonged activation of the body's stress management systems in the absence of the buffering protection of support. And when we think of support, we think about other people, other systems in place. Toxic stress emerges in the face of loss, conditions of continuous family chaos, persistent emotional, physical, or sexual abuse, chronic parental depression, persistent parental substance abuse, or other manifestations of addiction and ongoing emotional or physical neglect. Results in increased arguments, resentments, attention-seeking interactions between family members. Those of you who've risked working with families in the past, particularly in early recovery, see all of these: arguments, resentments, attention-seeking interactions between family members. Noticeable patterns of triangulation and blaming may be common family dynamics, right? So the wound in the family system can impact much more than the family's life routine, and it can be observable through like disruption in a family member's stable patterns associated with their ability to communicate, their ability to hold discipline, have emotional support from one another. And enmeshed over-involvement often results then in like a lower level of functioning for the traumatized individual, right? But it is the way in which they've learned to survive. And in a toxic stress situation, that survival is at the forefront. It's also important to notice that when the primary trauma victim is a child, the mother-child relationship often becomes the one that is very, very close, right? Which then places the mother in that position of a guardian, even if their child is an adult, because they're compelled to manage care and ensure that their child is protected. I have a number of clients in my private practice in this position, right? Where I have an elderly mother who's caring for their 40-year-old son. And you can still see that relationship is extremely enmeshed and it's very, very close because of that. They're compelled to manage their care to ensure that their child is protected. But when they're if that same mother is in a marriage, then there could be marital conflicts due to like triangulation because the husband or the father is left out of that emotional connection, right? Other children become parentified in an attempt to balance the system. There can be like acting out behavior in an attempt for attention. And then when we are beginning the recovery process, recognizing that there's just stress and change, even a positive change. And you see this very commonly, particularly in young children who don't understand, even when, a husband and wife are like, they're getting along well, they're in recovery, they're supporting one another. And then the children start to really act out. And they're like, I don't understand. Things are going so well. Why are they being so awful? Right? That's that response, is that the children recognize that if they have lived inside of a toxic stress environment for so long, that their entire way of like operating is through fight and flight neural pathways inside their brain. And so when those are no longer activated, it doesn't feel right. Even if it's good, it takes a while. And so what they try to do is they try to recreate toxic stress within their home to get back into the part of their nervous system that has been used the most, right? So I always like to talk to families that are in long-term recovery, and they're making like, we're doing so well, but man, the kids, it's like, that's a good sign. That means that your recovery is taking hold and the children are reacting and responding to that because they're not in their cortex yet, especially young children, right? They're not online yet, so they don't understand. They just know the feelings of it, the emotional part. The limbic system is still running the show, and that's a good sign. And your sturdiness over time will help them rewire their nervous system to begin to trust that it's okay not to be in fight or flight all the time. All right, so we talked about the trauma itself. So maybe it goes without saying, but what is the importance of family recovery? The opposite, this is from Johan, I think Hari is how you say his name, but he did a TED talk on everything that you need to know about addiction is wrong. And it's an interesting 15-minute TED talk. It's has had a lot of views. And so that will be, I think Callie will send you guys the link to that. If you haven't read or listened to that, I highly recommend it. But this is a quote from his TED talk. So the opposite of addiction is not sobriety, it is human connection. So how do we stay connected with our loved one even when we are scared or angry? How do we hate the disease and love the person? How do we unite together against the disease? Being able to say, I love you, you are not alone. It is not easy. And families are trying to figure out how to do that. Because when we are bonding with what we are bonding with to manage with our pain in life, it might be a substance, it might be self-harming behavior, right? We are bonding with something in order to manage our life. So how do we bond with those that can support us and support one another? How do we need to be present inside each other's lives? I believe Trish has used this slide in the past, that rippling effect. For every one person lost to overdose or who battles a SUD, there are countless family members, community members, and friends standing in the shadows. The question is, who is treating them? This takes me back to when I was just a baby therapist, right? Brand new, just out of school, very eager, super excited to work and do family work. And I was working inside behavioral health for a company that worked with clients with SUD or dual diagnosis. And so part of my first job was to call families of clients that were clients that had come into a treatment and check in on the family members. And I worked with the population of mostly men were the clients, and they were like in their middle age, anywhere between 40 and 60, somewhere around there. And so I was calling a lot of wives or partners, and I would reach out, and I don't know the client at all, never met them, haven't read their chart, nothing, just calling the family member and saying, hey, I just wanted to check in with you. How are things going for you? Do you need any support? I want to make sure that, you have the care that you need. The initial reaction was usually, no, I'm good. I'm good. My loved one needs to work on themselves. They've, da 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 da. And I was like, okay. They're like, how are they doing? How are they doing? Are they okay? Is their medication managed? Like they start asking all of these questions. Like, I don't know. I am not your husband or your partner's therapist, and I'm sure you'll hear from them soon. I'm just calling to check in on you. How are you? Oh, I'm fine. I'm fine. And then I would pause. And that's the beauty as a therapist where you learn like the value of silence. You just kind of hold the space for a minute. And that stoicism inevitably turned to emotional space because nobody had ever cared for them before. You pause and then they would just start to cry, or where they would get really, really angry. And it's that space where you recognize right there that their care, their ability to be okay was so closely tied to their loved one's ability or ableness to be okay, that they were not allowing themselves to actually feel anything or allow themselves to be cared for in that moment. And that was when I was like, you know what? This is a population that doesn't have here. Your loved one is here 24/7, getting all the care, medical, all of it. And you're at home with nothing. And that's when I was like, you know what? We need to care for those families. We need to give them a space to begin to recognize that, yes, their job of keeping their loved one alive and keeping them safe and stable is now in somebody else's hands. And so let's now give you some resources and give you the ability to start your own recovery. And in the meantime, remain connected to your loved one. Because addiction is a disease of isolation. And so a lot of that like codependency or like that enmeshment is the family members striving to stay connected to somebody who has a disease that needs them to be isolated. So it's that push and pull constantly. And so the healing of this disease is through the connection to others and themselves. Is there a reason that when we are in early recovery that we have groups? Of course there is, because we need to be able to connect, right? Connection to others and themselves. So involving others outside of treatment becomes a critical element in supporting long-term recovery. Most human beings simply cannot tolerate being disengaged from others for any length of time. People who cannot connect through work, friendships, or friends usually find other ways of bonding, as through illnesses, lawsuits, or family feuds. It's from The Body Keeps the Score. I have a lot of anecdotal stories that I can use to support this. So I'm going to try to watch the time to make sure that I stay on track. But there was a client once who had entered treatment for the very first time. He and his wife had had a conversation. They were very connected to one another, he had an alcohol use disorder, organized around his alcohol use, and they had come to the decision together that he would go into treatment. He came into treatment, and the therapist didn't have a chance to reach out to the wife. 2 or 3 days goes by. He gets phone time. He can't get a hold of his wife. She's at work or she's at the dentist. She was at like all of these different barriers that came up, and he was unable to connect with his wife. 5 days later, he left ATA. And in his discharge, it's like not motivated for treatment. It's like that from a trauma-informed space, and recognizing that his need for connection in that moment was bigger than his ability to stay in recovery, right? We will choose our family over our recovery. They were both very anxious. They needed connection. They didn't need to, and people were like, oh, just leave him alone. He'll be fine. We've got him. Go take care of yourself. But they weren't able to do that. Why? Because they were craving that connection, because so much of their relationship was based around organizing around the addiction, that now they needed to build a space to organize around recovery and remain connected at the same time. The family experiences. Many families start to believe that they themselves can never be happy until their loved one is better. Their loved one's compulsions with substances trigger the family's compulsions to change and control their loved one, and the family becomes locked in the cycle that leads only to stress and unhappiness. And then when we isolate families from the client's experience, we get our clients all shiny. They worked on themselves, right? We get them all shiny and good. And then we send them home into the old system. And then when our client starts to change and the families don't know how to start their own recovery, so then the families reinforce the old patterns, and then they're the ones blamed when the clients struggle. Right? And they come back into treatment. They're like, oh, my family is such a trigger, right? They can't stay sober in their home. But the question is, does the family know the language of recovery or only the language of addiction? Because families will speak the language that everyone knows. Why? Because they desire connection. They desire connection, and so they will speak the language that they all commonly know. So having the opportunity to encourage the progression of care, to give more time for all to continue to learn the language of recovery and how to have meaningful connections becomes a key part of working with families. They're recognizing, you know what, we're learning something new here. We need some more time to learn new. Maybe I should go into, PHP with boarding so you can continue your recovery. I can continue mine. We can remain connected and continue to have languages of recovery so that when we do reintegrate into each other's lives, we're able to support one another in a reciprocal way instead of organizing ourselves around the addiction or the mental illness. And this is what I would call the parallel process, right? Recognizing that the family system is organized around our client. Language of trauma, mental illness, and addiction has been the norm. Beginning the language of recovery in parallel with the client. It might be the first time anyone has cared for their recovery. And it is an area for connection within the system, whether the family members are active, and this is a good point, whether the we see the family members as active at the root of their behavioral challenges, or might mainly bystanders, they will need care in order for our clients and ultimately the system to recover. So briefly here, we're going to snapshot of the system's perspective in therapy. So those of you that are MFTs, this will be review. I'm not here to make family therapists out of all of you, but I'm hoping to present a trauma-informed systems lens to show how we can walk alongside our families in their journey in recovery. Okay. So if some of this might be review and some of it might not, because there's five parts for the integration of a family trauma lens. Identifying common feedback loops. Ignoring the family increases their symptoms, right? We're talking about the family brain. Being able to validate the interactional patterns that serve as a function in the past. And explore realistic expectations for moving forward in recovery. So contextual implications of like how affirming the system reacts and responds. And then celebrating the strengths and finding joy and humor in the process. All ways in which we can be trauma-informed and family-focused at the same time. So let's go through these parts together. Let's talk about feedback loops for a minute. If feedback loops are always my go-to inside a family session when I'm not sure what to do with the family, right? What's happening? What are the feedback loops? Let's act them out. Let's play them out. Because when, Johnny says this and Mary responds with that, and then Alex shuts down, and then everybody, like there are these loops, and our families do them. I always love the very first phone call to a family member and client at the same time. So if they're in residential level of care, sometimes I'll have the client sitting in the room with me. I call the family member and you start listening, and immediately it'll fall into a feedback loop. It's really, really important information because it tells you where they are, right? It tells you at what level their functioning is, and also the way in which they are able to remain connected, even if it feels, maybe we might say, oh, I feel so unhealthy, or I feel so destructive, but it is functioning for them, which is the part that is always important to come back to, because that is their strength. But recognizing that someone starting early recovery, they're attempting to change that feedback loop. Why? Because they're changing. When any part of a feedback loop changes, the whole loop either adjusts or doubles down to get back to homeostasis. Again, that's where, if there's not a parallel process happening, that's that double down, right? They get back to homeostasis the way things were. Changing the loop creates stress in the relationship. That's real. It's not all shiny and roses when people are making positive changes. It stresses a relationship. Any change stresses a relationship. So when stress emerges, the fight or flight responses can take over. And that happens a lot. If you've worked with families, it's like the third session and suddenly it's super contentious. You're like, what? I felt like we were making really good progress. You guys were communicating so well. You were able to stay regulated. You were able to stay connected. What is happening? The stress of the change is instigating their fight or flight responses, and that takes over. And that's where co-regulation comes into play, right? Is recognizing that that is happening and that is okay. It's because you are adjusting to change, but we know how to handle our emotional state when we are in fight or flight so that we can get back into the cortex of our brain so that we can continue to move forward. But if they don't know that's what's happening, they feel like, oh, it's just, we're back to where we started, right? We're not making any progress here. And as therapists, we can feel that too. Like, man, they just keep repeating the same thing over and over again, right? They're trying to achieve homeostasis. They're trying to get back. And that makes total sense. Why? Because they need to stay safe. Families want to feel safe. They will do what they know to do in order to feel safe. Families that become reactive due to the unsure nature of change. So much like Trish has talked about in the last couple of webinars, is being able to recognize, regulate, and respond. That happens with families too. Can they recognize that this is happening? And then be like, oh, we need to take a minute to regulate together. Why? Because then we'll be able to appropriately respond to the change and make meaningful connections. Because change will create stress. So that family systems approach to trauma. Is your family sitting in their brainstem? Ooh, we're going to need some distress tolerance skills, aren't we? Right? One of my favorite things to do when I see families immediately hyperactivated is if I'm in person, right? Get up and go like, hey, I'll even use myself, be like, hey, I need to get a drink of water. Like, you guys want to, let's go get a drink of water together, right? Getting a glass of cold water works wonders. If it's a Zoom call, engaging them and being like, if the one person's shut down and the other person's activated, asking the person who's like shut down into hypo arousal. We talked about hypo and hyper arousal. Can you go get a glass of ice water for the two of you, and then we'll get started. I want to take a break for a minute, right? Recognizing that in that moment, you're not going to be having a conversation, right? Because they are in that fight or flight space. If the whole family is in like their limbic system, that's those emotional regulation skills. Use a lot of those. They're 5, 4, 3, 2, 1, stimulating your vagus nerve, breathing exercises, but doing them with the family, even if it feels kooky, even if it feels weird. Why? Because if we're too embarrassed to do them with them, they're going to be too embarrassed to do it with each other. So normalizing the experience and recognizing that they need to get back inside their cortex if this conversation is going to be able to continue. If they are in the cortex, great. Let's practice active listening. Let's use I statements. Let's discuss needs and boundaries, right? Let's build on reciprocity. Why? Because all of that builds connection, and connection feeds the part of the brain that aids in recovery. Because we talk about meeting our client where they're at. The same goes for their family. Where is their system located inside of their brain? Codependency is a word that's used a lot and recognized as a thing that we want to fix. We want to change. Codependency, you're not going to change that. It's not a fix. It's not something that you're going to be able to do in 3 sessions and at the inpatient level of care. That codependency has served a function for so long that until they recognize that that function is no longer needed, that's not going to change. And it's funny because a lot of times we, even as therapists, will want our clients to stop being codependent until the client's like, hey, I think I want to leave treatment. Then we quickly call the families. You need to convince them to say, we want them to be codependent at that point, right? So recognizing that it has served a function at this point is important for their own validation of being able to keep their system stable. But over time, it creates these weak links inside their prefrontal cortex talking to their emotional, the hippocampus is fairly weak. Why? Because they're in fight or flight all of the time. Their amygdala is really activated as it talks to their hippocampus, right? So they don't feel like everything is okay. It's a coping pattern, and it's been effective. When I would have really self-deprecating families, I know we're super dysfunctional family, and I was like, whoa, whoa, whoa. You're sitting here right now, which tells me you are functioning at some level that you are able to get to where you are right now. Let's figure out what is working and then increase that functioning. Not being like, oh, this family is so dysfunctional. They're so enmeshed. They're so codependent, right? It's that blaming of, because why? Because we sometimes as therapists are like, yikes, this feels like a bigger job than I know what to do. Again, connect, connect, connect. Our understanding of the brain helps to explain addiction as a family disease, because all members of the family develop unhealthy neural networks. They would not have been wired if not for the substance use that has been affecting their family, right? Families are impacted with physical and mental illness. They also develop similar kinds of emotional responses and behaviors. So when we place the health, welfare, and safety of others before our own needs, we lose our contact with our own needs and sense of self. Again, those phone calls that I would be making, and the wife would be like, oh my gosh, nobody's ever cared for me in that way, because I figured I'd take care of myself after he was better, right? And this impacts our relationships and our ability to have healthy relationships with our family and friends. And remember too, that generational patterns show up this way. Generational patterns like further solidify these pathways. So if those of you who've ever played around with genograms, and I'll talk about those a little bit later, is that you start to recognize, wow, there's patterns that go back 2, 3, 4 generations. So those neural pathways are really, really strong. And when we start in the early recovery space, we're like, hey, we need to change these neural pathways. Those pathways have been around a really long time, and they have served a very, very real function. So being able to respect that for what it is as we make changes over time. A little bit more about codependency. It's a type of relationship, like, yeah, enabling is actually a behavior. It's based in love, but it's rooted in fear. Of course, there's fear, right? They've been afraid for their lives. Can be a battle for control, attempting to save or protect a person, feeling or being addicted to the addiction. Some of our families actually need their loved one to stay sick because they only know how to exist in a system of sickness. Kids do this, like I was speaking to before, because when a system starts to get healthy, they start to act out because their neural pathways only know fight or flight. Or parents do this by reminding their child constantly, as like as soon as a child makes a couple steps forward, especially like you think about the young adults who are attempting to launch at the same time that they're in early recovery, that the parents will be like constantly remind their child about all the ways in which they made their life awful, right? They like need to pull their child back under their umbrella of care again, because that feedback loop gets jump started with every single conversation that reinforces that fight or flight. You need me in order to survive, because so much of their own identity has been wrapped up in that. And it's the only way in which they know that they have purpose and they function. To understand a behavior is to reduce the shame associated with it. It's to watch faces when they'll apologetically talk about the way that they navigate their system. I'm like, that totally makes sense. And they're like, oh, so like that's normal. Of course it's normal. Why wouldn't it be, right? Every member of a family system has a role, and recognizing each person's role to preserve homeostasis. Some really fun work that happens in, the outpatient and long-term care is beginning to like, hey, look, do we want to play around with these roles a little bit? They don't all have the same needs as we did before when we were organized around our mental illness. Now that we have some time under our belt, we're no longer in fight or flight all the time. Maybe these roles can be shifted a little bit. That's exciting work. It does not happen at the beginning as much as we want it to. A behavior that you do for your loved one that can and should be doing for themselves as another way enabling keeps a system together. A behavior often rooted in love with a desire to protect their loved one. It might be fueled by fear of losing that loved one. The behaviors often perpetuate the problems rather than solve it. Will this behavior protect the disease or the recovery? Some contextual implications. Being able to see, right, or think genogram, that where there are patterns in the past generations that support their current behaviors. Those in relationship with our clients may have other relationships with the same disease and past traumas associated with these relationships. This brings up, I have a brand new client recently who I met with a husband and wife, a young family, and he was in sober living. And she had said to me during our kind of get to know you space when I was talking about generational patterning, and she says, you know, my dad was, and she proceeded to describe her dad, which sounded very, very much like how she just described her husband. And she said, and the way that my mom's life was because of the way that my dad was. And I watched her trying to justify to herself wanting to change the way that she was going to respond and react to her husband based off of her experience of watching her mom respond to her dad, right? She could have gone down the destructive entitlement space and just did it the same way, but she was, without even recognizing it, she was intentionally trying to break generational patterns that were not going to function for her. She's like, I told myself I wouldn't do this. And so I set this boundary and I told him that if he was using, he could not be living at home. And she felt extreme guilt about that. Why? Because loyalty is so strong. She is loyal. She was struggling with the loyalty to the system in which she was raised and wanting to do something different. And when she did something different, as much as she knew that it would be healthier for herself and for her children, she struggled with the shame of breaking the loyalty pattern that had been set up for her and as a child, right? That trying something new. All of this is happening at the same time that we're then telling the same wife, well, you need to hold strong boundaries. And she's like, I'm trying to, but she's also struggling with the loyalty conflict she's having inside of herself based off of her own traumatic past. So just recognizing there are context to the ways in which our clients are behaving, right? We can't chase the behaviors. We have to recognize what's the root of them. And generational patterning is a big part of that. This, I wanted to highlight this because it's a lot of heavy stuff, right? We're talking about trauma, we're talking about generational patterns, we're talking about destructive entitlement, we're talking about codependency, all of these things that are like heavy, 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 heavy. You need to change it, need to fix it, need to fix it, right? Humor, joy, and positive memory building have got to be the additive effort when we're eliminating behaviors in which we are no longer serving our function. It's that counterpoint, right? Is recognizing that if life isn't worth living, then life isn't worth living. And recognizing that that's very true for people. And using that ability to celebrate wins, using joy, humor, positive memory building as a way of not only continuing to strengthen their connection and strengthen new change and new patterning, but also to bring that, to feed that other chemicals inside our brain, right? Feed the other oxytocins and serotonins and dopamines and all of that stuff that's happening inside our brain is being able to find the joy, humor, and positive memory building. I love celebrating a conversation when everybody stayed regulated. It's, I had recently been inside a family session. It was an elderly mother and her adult son. And we had one of those sessions where like it felt pointless, right? We didn't like feel like we moved forward in any decision making. We're just kind of like we're spinning our wheels. It's one of those where as a therapist, sometimes you sit back and you're like, well, that felt pointless, until we were recognized like we just had a 45-minute conversation that was kind of frustrating, and everybody was able to stay regulated for the entire 45 minutes. That is huge. This conversation could never have happened 2 years ago because somebody would have flown off the handle, somebody else would have shut down, right? And we never could have. So even though that is a huge win, and also we can laugh at it, we can be like, Well, we just talked for 45 minutes and didn't solve anything. And I'm like, whoa, 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 just a minute here. You actually done a huge amount of work because everybody was doing what they needed to do to be able to stay inside their cortex so they could actually have the conversation. And that is progress, right? It is a step in the right direction. Families require permission to enjoy life together. When I say permission, I put that in quotes because obviously we're not giving them permission to do anything, but it's like recognizing that, like, hey, it's good to have a good day. You're allowed to enjoy it. This is hard work, right? And crisis and chaos has been the organizing force up until this point. And then if we're not careful, shame and guilt will just slide right into that space of crisis and chaos. What else can we slide into that space? How about joy and hope? And intentionally work towards that. Because active gratitude and celebrations help the rewiring of the neural pathways in our brain. Why is mindfulness so big, right? Because people are actively trying to rewire their neural pathways inside of their brains. Why? Because if they can be using neural pathways that work for themselves, then they're able to stay inside the regulated space in their brain, and they're able to make connections that then feedback, again, another feedback loop of joy, a feedback loop of understanding, a feedback loop of just like, this is why we're here. This is why we make connections with other people. So what does a family in recovery look like? I have these last 5 slides and then we'll take a short break. Okay. So what does a family in recovery look like? I'm going to make a statement with each of these slides of what a family in recovery looks like. So you're like, I don't know what a family in recovery looks like. Well, here's some ways. A family in recovery builds on their skills of regulation so they can respond to one another in a way that is connecting. So you notice that a family in recovery is not a family who does everything perfectly. A family that, everybody takes care of themselves. No. A family in recovery builds on their skills of regulation so they can respond to one another in a way that is connecting. Changing those feedback loops as a way of breaking generational patterns, staying in the now and recognizing when dysregulation shows up in a feedback loop, stopping the momentum and practicing the skills together. I remember a program director at one of our sites said to me when we were doing some training on like measure-based care and skill development within the residential level of care. And she said, I have a client who had a relationship with her mom that she really wanted to improve. But the problem with their relationship is that she's like, I can't talk to my mom because I always just start to cry. Right? Now, crying, as those of us who know a little bit about brain science, like crying is a way of regulating. The just before crying is telling you that you're dysregulated, and then the crying is the body's attempt to re-regulate. And so clearly talking to her mom made her dysregulated, and then crying was her way of trying to like re-regulate herself. So she's like, what I need to do is that needs to be on my treatment plan to be able to connect with my mom without becoming dysregulated and needing to cry. Because as soon as she would cry, it would set off a feedback loop that was not helpful for her recovery. That became her plan. And she said that the first time that they talked, it was, I made it 5 minutes before I felt like I needed to cry. We're like, okay, so what worked? How were you able to keep yourself inside your cortex for that long? Let's celebrate that and recognize with mom. Hey, mom, do you see what just happened here? Your daughter, you guys had a conversation. You were able to talk about what you did for dinner and how you spent your evening, and she didn't break down and cry in that moment. Why? Because she was able to stay regulated. That's awesome. How do we make it to 15 minutes next week? How do we make it to a half an hour? So that by the time she leaves treatment, she's able to have a conversation with you in which she can connect. You guys can continue to grow together and be able to be regulated. And the mom's able to be like, you know what? When I get upset, this is what works for me. Daughter's like, when I get upset, this is what works for me. And they were able to support one another in their regulation skills. Why? Because they needed to break that feedback loop, because that feedback loop was continuing to keep them inside their system of sickness. They needed to get to a space in which they could begin their recovery and they could do it together by connecting. It's so simple and yet so it's one of those spaces that we just don't think to go there. We don't need to say, hey, this mom is so enmeshed in her daughter's life that she triggers her daughter every time they talk. That's very like, that's problem focused, right? So like, what's the solution? I want to be able to talk to my mom without falling apart. Okay, how do we get from here to there, right? Because being connected with your mom is important. And it's something that you want for yourself. And I, as your therapist, need to help you get to a space where you can get into your relationships as you feel that you want to. We can't save them from the life that we wish that they would lead. We need to encourage them along the life that they want to lead. A family in recovery develops clear thinking, so healthy patterns will follow. This is when we start to think about boundaries, right? Because enabling and poor boundaries can cause people to tolerate progression of worse behaviors, and then they never would have envisioned allowing in the beginning. It's often fear and our going against our own boundaries that leave us so angry. So our emotions can determine our actions. Beginning to regulate daily and choose how you want to respond. And then there are people who prefer to be angry. Why? Because they feel like if they can get dysregulated, then they get it all out, right? So they don't see the benefit necessarily of staying regulated. And so then they're angry a lot. A family in recovery has boundaries that support each other's needs by using skills of collaboration and creativity. And we'll talk about the how in the second half of this, in this webinar. But being able to recognize that when chaos reigns, we find ourselves far from the values we believe in. Boundaries enable us to work towards aligning with our values again. A family in recovery moves from codependence towards interdependency as trust develops over time. So what is interdependency? There's a lot of words in this definition, but each person in a perfect world, right? In a perfect interdependent relationship, each person would have a strong sense of self, making decisions for themselves while being considerate of others. There's a balance of give and take, and experience the fullness of personal feelings while also being able to validate other people's experiences. They can disappoint others and still know that they're worthy, important, and lovable. There's safety and security in the relationship, even when there's conflict and disagreements. When I'm listening and working with families, any one of these things, if I see a glimmer of it, let's build on that. I noticed that you guys were able to hear each other have this conversation today. I noticed that even though somebody was afraid they've disappointed you, that you were able to tell them that you still loved them, right? I was able, any of these little nuggets in here help move them towards interdependency, saying it's like, stop being codependent, right? Because we have to build trust over time. And I put relapse care in here because I've worked with countless couples that as they move towards interdependency, if their partner, and then we're talking like long-term, like these are couples that I've worked with, 6 months, a year, longer, if their partner has a lapse or a blip or even a full-blown relapse, they are able to be okay, even while knowing that their loved one is struggling. Why? Because they've built trust, they have a give and take. They are able to stay inside their cortex and not become reactive, right? And then they're able to care for one another by getting the help that they need. A family in recovery recognizes their role in the family system and seeks to make other outside connections for additional support. A family inside a family system can't be everything, right? There's a reason why we encourage our clients to get sponsors. Family can't be their sponsor. Why? It's a different role, right? So, and a family member needs other people too. Remember that mental illness and addiction is extremely isolating. So families themselves become isolated and they become this little tiny isolated system that's organized around the chaos. And so then when they begin their recovery, it's being able to look outside of their family system for additional support. That's also a family in recovery. Building their protective factors, right? Their own physical health, their own social supports, their own self-esteem, coping skills, sense of purpose, healthy thinking, right? Beginning to define new roles in the family and learning that language of recovery. This is where I would like to take a 5-minute break before we move into the practical of empowering families to unite and heal. So I have the time at 11:08 my time on the East Coast. So let's come back at about 11:13 and keep going. If you have any questions for me that you'd like to send in the Q&A, go ahead and do that. And I will take a look at those during this break. Okay, let's go ahead and get started again. Thank you for the questions that are coming in. I, um, I'm going to address just one or two of them now, and then some of them will show up in the second half here. So hopefully I be able to touch on them. One question was about secondary trauma and vicarious trauma, the difference between the two. The way I like to think about it is, and I just conferred with a colleague of mine to make sure that I was kind of on track here, is that secondary trauma, particularly for therapists, when we think about therapists who feel secondary trauma, that's like what happens when you hear about it initially, right? It occurs like suddenly. And then vicarious trauma would be like representing like the shift that we feel as clinicians in our own attitude and worldview over after like prolonged exposure to patient suffering. So it's, and that you can see how that would happen even with families, right? There are those families that vicarious trauma that they really struggle with, like this world is falling apart, right? Like over time, having been traumatized over and over and over again, or being witnessing it over and over again, they actually change their worldview. So that would be that vicarious trauma space. So I wanted to address that question. The other question, a lot of you are asking for resources, so I will get with Callie and make sure that we send those over to you next week when she sends the recap. And the codependence in part, it'd be the same or part of the same as enmeshment. So I think of enmeshment as the actual behavior and codependency as the organization. So enmeshment sits inside codependency is how I kind of conceptualize that for myself. Okay, so now that you know about family trauma, you know, and how to see your families through a trauma-informed lens, and what does a family in recovery look like? So now, practically, what do we do as a therapist to help families get there, right? So we've like our goals and we have like our objectives now in our interventions. So how practically do we do as a therapist to help families get into their recovery process? Let's see here. Let's. No surprise. The first one on here is validation, right? Being able to create safety. Safety, as we know for our clients, is the most important first step in able to do work. Our families inherently do not feel safe. They just don't. There's been nothing safe about what has been happening for them. And so recognizing that, even when they pretend to be okay, is recognizing that is their way of functioning in order to create safety for themselves. But as a therapist, we can validate their experience to help them create safety. That's that back to like, I know we're dysfunctional, right? All the time, I know we're a dysfunctional family. But actually you're here and you're alive, which shows that you're actually functioning. So what we're going to work on is improving it on that functioning, right? I'm not going to fix you. We're going to improve on what you are going to improve on what it is you're actually what is working and what is not, right? Exploring strengths and affirming them. Recognizing that their strengths are your strongest muscle. When I think about recovery, I think about a series of muscles inside our brain and our body in which we want to move to higher functioning. Much like if I like I said, when I was a farmer, I still remember like, I'm not a very big person. And I remember at one point I was using a very, very metal headed mallet to hammer stakes into the ground. And I could do it, right? And that I felt really strong. At the end of the season, I had to, like hammer more stakes into the ground, and I was swinging. And I'm like, this one's so light. Where was this one at the beginning of the year when I needed it? Until someone's like, it's the same one. Why? Because I was able to take a strength and build upon that strength to even then have more strengths, and affirming them of what it is that they're doing well. And there was a question in like, what do you do with like families that become very dependent on their therapist in order to be well? That makes sense, right? Because they don't feel safe without you, right? So recognizing that safety space is the space in which they can begin exploring how to be safe together. And it's always kind of coming back to like when clients do something bad, they blame themselves or other people. But when they do something good, they give credit to their therapist. Happens all the time. Oh, thank you so much that, you were so helpful to me. And we're like, no, 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 you did it. You did it. So it's continuing to point out their own strengths that I'm here to witness and maybe notice something different than you might be are noticing for yourselves because you're inside your system, but recognize that you guys are the ones doing the functioning. You got this, right? Recognizing your own strengths is a way of functioning and affirming those strengths and slowing down. This one is important, particularly for me. I tend to be a fast talker. I get really, really excited. I love this stuff. And sometimes I really quickly will conceptualize a case and I'll be like, ooh, I want to go here. I want to go here, right? You get kind of excited. And remember, the chaos of addiction also is fast. So you put those two things together and families will come in very amped up to move very quickly, right? Time is of the essence. And one of my colleagues, you'll probably hear her speak towards the end of the year. Her name is Gwen Swift. She is amazing at this. She's like, slow it down. Don't catch their chaos. Slow down the process so that they can start to feel safe in the lack of chaos, right? Slowing down the process. Slow everybody down to create safety. And then we have to build a therapeutic alliance. And yes, I'll hear those of you say, well, but I'm not their therapist necessarily. I have their loved one is my client. Yes, but that doesn't mean you can't have a therapeutic alliance with more than one person inside of their system, right? Begin to validate their struggles and their courage. Courage is big. They're showing up. I remember a therapist saying, but like they don't want family therapy. Nobody wants family therapy. I'm like, I don't want family therapy. And I'm not, I would consider my family system, functioning very well. I don't know, thank you. Right. So of course it's a scary thing to get everybody in the room and chat. Right. And that takes a great deal of courage and validate that. Right. Honor their experiences, especially when you are talking to parents. There's nothing more terrifying than thinking you're doing a bad job or that you don't know your kid, right? Their experiences are real and honoring them and recognizing that they're the experts within their own system. We're on the outside looking in. When you're starting to work with a new family and they talk to you for 10 minutes, they're like, okay, what do we do? What do we do? What do we do? And we as therapists are like, well, so we need to really work on your codependency and we need to work, like we start to like dictate what it is they should do. I just like to stop and be like, so I have had a 10-minute conversation with you. I don't know you. You tell me what needs to be done because you guys know you are inside the system, right? And begin to slow down that process and honor their experiences and listening. I like to say this too, because this was a learning curve for myself. If I get to the end of an interaction with a family, a session or a phone call or a check-in or whatever, and my mouth is dry, that's a good indication that I wasn't listening enough, right? I'm working too hard. Being able to move at their pace, not the pace that I want them to move at, right? Being able to create mutual conversations based on their concerns. And respect. Respect is so big. I had a client, a couple that I was having a hard time building a therapeutic alliance with. Granted, it was the very first session, but it wasn't until the end of the session when I said, I know you said you've only known each other for 6 years, but I would never have guessed that. The way that you guys understand each other, validate each other, honor each other is far wiser than that. Bam, just like that, had that connection. Why? Because they saw that I respected them and their relationship as they saw it. And it was so vitally important for us to build a strong therapeutic alliance so that we could begin, taking a look at the way in which they interacted with one another and build from there. Right? And here, The actual title of this webinar. What does co-regulation skill development look like inside a session? I want to spend a couple minutes on this slide because I think I want to make sure we don't make any assumptions. Don't assume that families can see the benefits of staying regulated. Because remember that remaining in fight or flight, first of all, might be more comfortable. It's more well-known, more established, but it also could be the only space that they feel like they're allowed to say what they feel and think, right? So when you think about that you might have a fight with one of your loved ones, and someone says, well, you just need to calm down. First of all, that doesn't work, but also like, I don't want to calm down because I want to get all these things out. I want to be able to say all of these things that are coming to me right now. So there's no benefit. It doesn't feel like a benefit to become regulated. And so when I'm working with clients and families is being able to give them the information about the why, right? What do we mean by your cortex or your limbic system or your brainstem? What happens in each of these different spaces inside of our brain? Why is it that when we are in a session together in early recovery and trying to develop new patterns or recognize get new insight into our own system, why do we want them in their cortex? Why? Because when you're in your cortex, you can make decisions. When you are in your cortex, you can see time outside of the immediate, right? So being able to say, hey, I know that you are having an emotional experience with your life right now. When we are in this session, we are going to practice staying inside our cortex. Why? So that we can gain more insight into the way your system works, so that we know how we want to move forward. So we can be connected. And so how do we do that? There's lots of books on DBT skills, right? And emotional regulation, distress tolerance, all of that kind of stuff. Sure, absolutely use those and use them with both, but it's also check in with them. Figure out what tools they already have. Instead of coming in and saying, okay, so you need to do this, you need to do this, you need to try this, you need to try this. They might have a way. They already know how to manage their emotions when they want to, right? So part of it is getting them to want to manage that emotion dysregulation so that you can make some progress within that session. So it's like honoring the fact that I understand why you want to be emotional in this space. It makes sense to me because nobody's validated your experience at this point. And at the same time, we want to practice re-regulating ourselves so we can stay inside our cortex so that we can begin to communicate with each other in a way that it is connecting, which ultimately leads towards recovery, right? So figure out what their tools are. Ask them what works for you. Again, I'm real big on getting a drink of ice water. Why? Because first of all, it gets you up, gets you moving, gets the cold, the serotonin hit, like all of the things. Another way to begin is like doing that body scan at the beginning and at the end of, and even during a session. All right, before we get started, everybody do a body scan. How are we feeling, right? Why? So that they can begin to experience together the ability to recognize what each other are in different brain states. Because we're so inside focused. It's all about me, right? So be able to like, oh, I'm recognizing that you are dysregulated. Instead of being like, I'm fine, you're a mess. Being able to be like, I'm fine, can I help you be fine right now so that we can both have a conversation together, right? It takes the judgment out of the fact that we might be in a different brain state. Think about it with young children. And they're never in their cortex. Their cortex is hardly developed, right? And so they're always in that like emotional space. And are we going to shame them for it? Some of us were. Some of us were shamed for that space. And those of us that were raised in a household where like just recognize that we're just dysregulated right now. And so we need to spend some time re-regulating and doing it together. A common practice is, and I used to do this, and even with my oldest child, I used to do this. I look back on it and I cringe, but when she would be dysregulated, I would send her away from me to re-regulate. What kind of message did that send? You are not worth being in relationship right now because you are not in the same brain state I am. Very unfair, right? But we do that to our clients. We do that to our families. And so being able to recognize that that's what's happening and that's okay. And it makes sense, right? These patterns have happened. when you watch a family kind of what we would consider maybe like fall apart or become activated, I like to stop because I need to make sure that everybody is safe. And I just like to say, hey, I'm noticing something here, and I just want to like, is this the way you guys usually interact with each other? And they're like, yep. I'm like, okay, so it's a me issue. It's not a them issue. They're used to it. This is not different for them. It's just different for me because I'm not inside their system. So giving them the skills to be like, all right, we're going to work on getting into our cortex so that we can figure out what's our next day. What is it that we want to talk about? What is it that, how can we stay connected inside our recovery? How do we start learning the language of recovery? Love this. Utilizing our cultural strengths. Every single one of us is inside, we have our family system and a greater system. We have our cultural system. And all cultures have a strength, right? All cultures have a weakness. Sometimes it's the same coin, it's just on different sides. Conversations about their cultural background, first of all, is a way of validating their experience, right? Honoring them, respecting them. And it always reveals a strength that we can utilize in our recovery space. Sometimes people that struggle with like a lot of guilt or shame, they'll only point out the bad parts of their culture, which is not too hard for us. It's, power of the positive reframe, right? We can always flip it because the other side is the flip. One that comes up a lot is about like my ego gets in the way. My ego gets in the way. I have such a big ego, right? That's one that shows up a lot. And I was just like, or that strong ego, when it's put towards something that you are proud of, it's actually like really powerful and good. Oh, right. Right. Because our cultural strengths are so heavily tied to our value system. And we know inside sickness and addiction, our value system is compromised. And so being able to kind of have those conversations about like, what do you value? What is your family value? What is your culture value? Great conversations like we value persistence. Great. How is that a strength for recovery? Well, it gets me to stay in treatment even when I want to leave. Fabulous. Like, let's use that, right? We really value kindness. Okay, so how can we care for each other? Like, I can care for you even when I'm angry. Why? Because kindness is a value inside our cultural system. Maybe you have a really strong spiritual aspect. We all share a higher power outside of ourselves as a guiding force. Let's use that. Like, that's fabulous. What if humor, right? That's right. Then you're willing to see the absurdity in life and you're able to laugh at it, right? Our value system is tied to our culture. And inside of that culture are the strengths. Of course, there are weaknesses to everything. But how do we utilize that to move forward? This is a big part of working with families, is the education piece. As I mentioned at the beginning of this webinar, we do an education series for families on Mondays and Tuesdays, right? Why? Because giving them some starting language is kind of like when you learned Spanish and the first thing you knew is, me llamo, right? My name is, in hello, hola, adios, right? You need to have a starting place. And so the language of recovery can replace the chaos or crisis of addiction, beginning to start that language. Education for family. Now, skill development also sits in that space. What do they need for themselves? What education? They might not know. Identifying their tools for their toolbox. Some brain science stuff. Also, like family dynamics, roles, and expectations. Insight into what is happening within their family dynamics. And it's fun when you're working with a family and you've identified a feedback loop together, right? I like get out the whiteboard and be like, all right, this happens and this happens and this happens. And they're like, oh my gosh. And then like later, a couple sessions later, they might say to me, we realize that we do that feedback loop like 3 times a day, right? They're having insight into themselves and their family dynamics so that as they continue to change, they can see how that changes. And that's so empowering for a family. Then it requires some education. Why? Because we want to encourage family resilience. But what is resilience and how does it impact my family? That's all those different protective factors that helps build resilience. They're in that diagram there. Your family strengths. Resilience develops as individuals learn better strategies to manage stress and life's challenges. There's nothing more exciting than to see a family's resilience on the other side of a crisis. Building resilience involves tapping into your personal strengths and supports of family, colleagues, and friends. Some examples of some skills of that would be like loyalty and the fact that they're still supporting their loved one, right? Helping them see how they can use this in a positive way rather than like enabling them. Maybe dealing with adversity builds resilience, helping them see the ways in which they've gotten through adversity, how talking to others, attending meetings, whatever it is that they're doing, like how did they get to where they are right now? Help them expand on how to continue that strength, right? Help them that they see that they can use this combined with like communication skills and boundaries. Maybe humor helps you with resilience. And how's that helped? And how can it be used moving forward? Maybe love. How has your love blinded you in the past, but how can you use your love as a strength to set healthy boundaries and by taking care of yourself, et cetera, and et cetera, and et cetera, right? You need to see that family strengths are and discuss them in ways in which they can use and expand them to help them through this. They've already done it, so let's honor that. How do we assist the family in healing? By addressing their questions, concerns, nudge how they interact within that family system, improve their communication. I love to think of these sessions should be facilitated with an eye on their current level of insight, right? And the ability to stay in their cortex during sessions. There are some families that can tolerate a 10 or 15-minute phone call, and that's a successful session for them. Like that is a successful family engagement space because that's where they are at this moment, right? And others are like, nope, we can do more than that. And that's okay. But recognizing what is happening within that family system and helping them recognize what is happening. Again, back to that girl who would cry when she would talk to her mom. Reducing the emotional burden for the family. Mindfulness activities exist for a reason, right? Because they help us widen our window of tolerance. Helping the family learn ways to support their loved one, particularly creating a plan for addressing warning signs. Hypervigilance is real, right? Walking on eggshells is real. Waiting for the next shoe to drop is real. So let's talk about that. Let's talk about that when we are inside our cortex so that when we get bumped into our limbic system, we already know what to do because we have a plan. And then begin to examine roles and expectations with each member of the family system. Are we able to say no? Can we tolerate consequences? That's a big one. So how do we support systems? By encouraging families to work on their own recovery. Again, giving them permission to build support systems. You're allowed to involve other people, right? Who are the other organizations, anybody else who might support recovery? Something like, well, I thought about, joining a support group, but I wasn't sure if I should. Absolutely do it, right? Support families, particularly supporting parenting supports for those that need them, right? Because as I said at the beginning, there's nothing more terrifying than thinking that you're messing your kids up or that you have. Helping them build support systems. So what could this look like inside the continuum of care? Well, we know that family involvement is necessary, right? We've kind of talked through all of this. These are some statistics. This is a slide that Trisha's used in the past. I'm just put it up here because I think it's important, is recognizing that of all of these stats, it's family, friends, families, friends, 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 families, right? They are the people that want to be involved. They are the people that are like contacted when necessary by our clients. Why? Because we all desire connection. So what are the barriers to the family? A lot of it's professional resistance. And I like to think when people resist doing something, it's usually like one of two things. Either they think it's dumb, it's not worth it, it's not important, or they don't feel like they can or they know how, right? And so recognizing if you fall on one or the other, or hopefully neither, is that's where that resistance comes in. I actually not sure exactly how to do this. Hopefully you've gotten a little bit of insight into just slow it down, right? Stop trying to fix the family system quickly. There's too many moving parts. It takes a while, right? Engaging with a patient. There are patients that will say, no, thanks, no, thanks, no, thanks, no, thanks. The question is, well, actually it's part of, your treatment. So yes, the answer is yes, because they're part of your system. And in order for you to move forward in recovery, you need to be connected to your system, that whoever that system might be for them. And you're going to go home to live with that person, or you told me that you call them every single night during phone time, right? So yes, we do need to engage with the patients inside and their system. Some other barriers might be protecting the patient from their family and their environment. This we can't save our clients from the lives they choose to live, right? But if there's no insight, they'll never gain insight into what they can see and you can see if we just ignore them, right? We can't just ignore them. Our family fears in secret, validating them and normalizing them. When a family reveals family fears and secrets, is being able to not be shocked and dismayed and, oh my gosh, it's like, yeah, that happens. It's true. Right. So I kind of broke down these next 3 slides of different levels of care, right? So at the residential level of care, particularly thinking of not trying and fix codependency, not at this level of care, and not to dig into the trauma at this level of care. We have some healing to do first. We need to create safety first. We need to have the skills to be re-regulated before we can move into spaces that purposefully dysregulate us, right? There are skills that we need to have at this level of care. So connecting early and often helps with the anxiety of the family member accustomed to being the person that kept their loved one alive. Like, oh, they're helicopter parents. Why do they keep calling? Well, it's been their job to keep them alive for the last 18 years of their life. You've taken their job away from them. Of course, they're going to be anxious, right? They want to hear their daughter's voice, right? Because that has been how their entire world has been organized. So connecting early and often. And recognizing that some families, they need rest. Hey, being able to assure them, we got them right now, right? You can take a break. And some are like, oh, it's the best sleep I've ever gotten, knowing that my loved one is in care, in the residential level of care, right? So not waiting for that phone call. They're not afraid to walk into their bedroom at night and not see their, not to see their person breathing, right? They are able to rest. The residential level of care is beginning sessions to work on recognizing interactional patterns so they can regulate together and communicate more effectively. That's a big ask. You might never even get to all of that, but beginning to recognize their interactional patterns. Well, yeah, every time he says that, I do this. All right, let's talk about that. How's that functioning for you? What is that? What works? What's not working? How can we do it differently? Is there something you would like to do differently? And recognizing that the ability to stay regulated is so much tied to this, right? Because we cannot communicate effectively dysregulated. So having that continuum of care conversation, both the education aspect of it and the tools to encourage long-term recovery. As I had mentioned earlier about that client that she said, you need to go into sober living. You can't come home right now. Why? Because I don't have my tools aren't strong enough right now to be with you all of the time when you are in early recovery. We know the research. The research says at least 90 days, if not longer, for the best outcome, right? We know this, but families sometimes feel like, oh, they need the person back too. Like, I want you back. So being able to both give them the education and the tools to encourage long-term recovery and the permission, because there can be shame. You've been gone for a month. I don't want people are going to like wonder where you are, right? Just recognizing the long-term recovery and having those continuum of care conversations. And also know that some family members need a job. So, when you think about the depression or anxiety spectrum, those that struggle more on the depression side, they just need a rest. They want to rest. They crave the rest. Some need a job. And so being able to have conversations about roles with the client and you and the family, be like, okay, so we need a doctor's appointment. Who's going to do what and how do we want to do it? Being able to help find aftercare, make doctor's appointments, et cetera, because that also can move the family forward in recovery. In the outpatient, or like the PHP, in the IOP level of care, when we begin to start integrating slowly back into our daily life. Establishing a relationship with those that support our clients in the early days of PH or IOP. Why? Because if someone doesn't show up to group and the therapist is like, hey, they didn't show up today, and they call them, are they going to answer? Of course not. They didn't show up to group. But if you have a relationship with their closest family member or friend or who their people are, they might know, right? And we might be able to encourage them to come back. You might be able to recognize if there's like a lapse or they are needing help in some way, right? And everybody is then connected. Everybody knows. It's very transparent, very trauma informed. So sessions to continue regulation skills, be able to build reciprocity in relationships. I say this because relationships are on, back and forth, reciprocity. And sometimes for our clients, they feel like they have nothing to give in a relationship because they have been the ones that have been ill, right? They're the ones, so everybody's caring for them. They're the IP. They are the identified patient. But over time, to be able to build reciprocity in relationships, to be able to say, hey, listen, mom, why don't you go take a break? I'm okay right now. Why don't you, go get your hair done? Or why don't you go take that class you've always wanted to take, or change a job if that's something that you've always wanted to do? Being able to have conversations back and forth while we are in our cortex to build reciprocity inside relationships, and start to think about roles and how they might shift as we move along the recovery spectrum. Each family member to be able to identify their needs and create boundaries that support those needs. That's that interdependency space, right? Because when we don't have safety, don't feel like we can say what we think, what we feel, what we need, right? But as time goes on and we begin to recognize that I can ask for what I need and it doesn't dysregulate my family member, which then puts them at risk of, falling outside of recovery. We could why? Because we have built up that muscle, right? We've been swinging that hammer for an entire season and we are stronger now. So we can begin to identify what we need. And our aftercare plan needs to include your family supports, identifying their particular relationships. Parenting relationships, like couples work, that's when they're like, oh, this has been really helpful. And we need to find a family therapist, and helping them to find one, right? I said, I wasn't going to try to make you all family therapists, but recognizing the need for it is also helpful for our families. And then what about long-term connection, right? Families engage in family therapy to begin their process through trauma. There it is, right? Families continue to grow in their interdependency. Their connection becomes safer as that trust grows. They start building good memories and a bank of joy to pull from in hard times. They have a plan for slip-ups or relapses that is well established in long-term recovery. They start to have a lot of faith in their ability to navigate life. Their resilience grows big time. And that's very exciting to see. But in conclusion, last few slides here is, if you take nothing at all from this webinar, please understand the importance of connection. Connection, connection, connection. All of us can do that. You don't have to be a family therapist to understand the importance of connection, because trauma is the loss of connection. The disease of addiction lives in isolation. Healing occurs for both through the connection to others. So then treatment is about exploring boundaries while staying connected. Where do I stop? Where do you begin? And our ability to communicate impacts our connection. What different types of connections might we run into? Right? The nature of each relationship inspires different types of connection, different experiences of power and responsibility, and has different needs. There are such unique facets of each of these different types of relationships. I just picked 6. There are more. These are 6 common ones. But how for partners, connecting with partners, right? Remember, this is a chosen relationship. So they chose these people for a reason. It's not our job to judge or label these relationships. It's our job to support our clients in making their own decisions about the relationships from an informed lens, right? Connecting with like parents of pre-launched adults, right? As a parent, you know, when you watch your toddler fall down, scrape their knee, and you run over to clean the wound and comfort them, right? So now that you're watching your adult child fall down and scrape their knee, figuring out how to support from the sidelines, you might yell, "There are band-aids in the cabinet," right? These parents may have some of that shamey shoulds. My kid is an adult. They should be moved out by now. They should have a career figured out by now. All of those shoulds. Whenever I hear should, that always makes my I kind of perk up a little bit. Like, what's behind that, right? Remembering that like milestones with parenting can shift when there's illness present in the family. And they get blamed a lot for like being too involved, like helicopter parenting, right? But being able to know why that might be the case is a really important step in being able to connect with parents of pre-launched adults. What about elderly parents? When I think of just in here, considering generational norms, consider that stage of life cycle, right? So according to like Erickson's stages of psychosocial development, at the age of 65 onward is characterized by the integrity versus despair space. So when parents are looking back on their lives, taking inventory of accomplishments and making sense of hardships, being able to, and I've worked for whatever reason, I tend to get this demographic a lot in my private practice. Is there's like this like guilt and ego space where like they want to know that they feel like they've done a good job for what they knew at the time, and yet they're being told that they should feel guilty about the way that their children are raised or the way that they're behaving, right? So there's this push and pull, push and pull. So recognizing that they're trying to make sense of their life, right? Looking back, taking inventory of their accomplishments, making sense of hardship and also their own aging process, and recognizing how do you connect with somebody like that? How do you connect with elderly parents? How do you connect with siblings? Siblings hold a very special space for me. Some of my very early work was like working with siblings in early recovery. It's an extremely unique and special relationship. The level of care and understanding and sometimes the responsibility with siblings. Siblings are usually the ones that, because remember, siblings are the people that were like raised with you, right? So you have the longest relationship, probably the most intimate relationship could be with a sibling. And recognizing that they may be the ones that recognize the illness or the addiction first. They might have been the ones that had to protect the family. They might be the ones that had to protect other people within the family. They had to care for the parents. They were like usually the secret keepers. Like siblings hold so much. And so when they've become almost like caretakers in their own right, they might email you 15 times asking for like, what medication is my brother on, right? Or they're the ones that like send you a list of like outpatient treatment centers that they've heard good things about, right? Because that's how they know to function within their family system. And we don't need to get mad at that, right? It works for them. Find a way to help them to heal. How about young children? Kids are little sponges, right? They're making sense of their surroundings and assigning stories and meaning to their day-to-day lives. So whether or not the people around them put language to it, it's happening. Kids are also incredible protective factors for our clients. So connect them. Help to make this a supportive and meaningful memory that kids can look back on when they're older, not a vague, mysterious one that's scary. What about adult children? These relationships are some of the most telling of generational patterns and the direction that the next generation takes that stuff. When I talked about that client who decided to do something different, right, because of her experience as a child, it's not their job to absolve their parents of anything. It's also not their job to take care of and protect them. But remember, kids will spend their entire lives trying to figure out how to forgive their parents. So recognizing the dynamics of all of these different sort of family relationships and then how we can then connect with them. It's not a one size shoe fit, like it's not a one shoe fits all or one size shoe fits all, whatever that saying is, right? It's each of these different interactional patterns have different strengths and finding out what those strengths are so that you can move into recovery. Why? Because we want to give them hope. Out with the new, in with the old, right? And they have to happen in parallel. New science shows that kindness, right there, kindness, it's like the best thing. Not niceness, kindness, right? Kindness, positive reinforcement, and motivational behavioral strategies can help families support their loved one through recovery. We can't chase behaviors of our clients. We can't chase behaviors of our families. Using the transformative power of relationship, positive change to remind us that although no one can change another person, we can only help in inspiring that change. There's another TED Talk that I want to refer to by Rachel Wurzman. She did one on how isolation fuels opioid addictions. And she talks about how loneliness leaves our opioid receptors wanting and needing to feel balanced, that we will seek relief any way we can. So if someone is using a behavior or a substance in order to achieve balance in their life, and we've taken that away from them, right? Loneliness will be sitting in that spot. What are we going to do? We've got to get them connected. We have to connect. And the same trauma has happened on the other side too. Every member of that family is having a similar experience. Shows up in different ways, but the trauma exists. So co-regulation, being able to together is connecting. Co-regulation enables us to have insight into our dynamics, sets us up for meaningful responses to one another, which then strengthens our connections, which feeds our brain with the chemicals it needs for healing. Now that is a glorious feedback loop, right? We're replacing ones that are harming us with ones that are helpful to us, recognizing that when we can see the dynamics of our relationships, because we can stay regulated, then we can connect, which then feeds our brain with the chemicals it needs for healing. Take a quick look at the questions here. Yeah, a lot of questions about educational resources and whatnot. So we will definitely get those out to you for sure. And you know what? This has come up lots and lots of times. So we have some. I don't have them on me at the moment, but recognizing how do we balance? I'm not sure what that is. Good books on regulation, for sure, for sure. There was a good question about the effective ways of addressing intergenerational trauma within a family. That's long-term, that's longer-term work. But sometimes it's just validating that it actually happened. Oh, I see that happened. That in and of itself is a space for our families to suddenly recognize that they're not alone, right? Is being able to recognize that okay, this happened to me and somebody heard it. And so being able to address it is, we can't unpack that until we have the regulation skills necessary to be able to put ourselves back together. But recognizing that it exists and almost normalizing that experience is very, very powerful. It's powerful for our clients. So it's also powerful for our families. I have some references and resources that we will send along your way. But I want to thank you all for being here today. Thank you. If you have any questions, please, other questions that I did not address, or you have something comes to you later, please don't hesitate to reach out at pbhu@promises.com and save the date for next Friday, April 26th. There's a new series beginning. You'll be able to register on Zoom for that. So thank you for your attention today. I really appreciate all of you and all the work in which you pour into your clients and hopefully families too, because I truly believe that everyone deserves recovery. Have a wonderful day.